All right, good afternoon, everyone. We're going to go ahead and get started. Thank you for joining us this afternoon. My name is Caroline Stakowiak, and I'm the program coordinator with the National Volunteer Fire Council. I will be helping to moderate today's webinar, Reset and Recharge, How to Manage Stress in Uncertain Times. I'd just like to go over a few housekeeping items. We will have a Q&A following the presentation. You can submit your questions at any time using the Q&A box found within your Zoom screen. We will only be answering questions related to managing stress and will not be answering clinical questions on the COVID-19 disease. However, we do welcome any questions related to the PowerPoint presentation today. And this webinar is being recorded, and we will have this available on our YouTube channel. So that's the NVFC YouTube channel that will be available to the public. I will also send out the slide deck to all registered individuals. So for anyone unfamiliar with the NVFC, we are the leading nonprofit membership association representing the interests of the volunteer fire, EMS, and rescue services. We serve as the voice of the volunteer in the national arena and provide invaluable resources, programs, education, advocacy for first responders. If you are not a member, we would love to have you join us. You can do that by visiting nvfc.org/join-nvfc. And now I am happy to introduce our moderator for today's webinar, Chief Kevin D. Quinn. Chief Quinn joined the fire service as a volunteer in 1976 with Station 3 of the Union Fire District in Rhode Island. And he retired as Deputy Chief of the Union Fire District. Chief Quinn continues to respond to fires and alarms as an active volunteer with his original station. Chief Quinn holds a Master of Science in Counseling and Educational Psychology and a Master of Science in Education. He retired in 2007 from the public education system. Chief Quinn has represented Rhode Island on the NVFC's Board of Directors for over 36 years. He is the immediate past chair and is currently serving as our first vice chair as well as vice chair of the Health and Safety Committee. And now I will turn it over to Chief Quinn to introduce our panelists for today's webinar, Jeff Dill.
Thank you very much, Carolyn. And I am proud to be an American, and I'm just as proud to be an American volunteer firefighter. We are called to duty at a time of tragedy and great need, at a time with uncertainty, unknowns, and disbelief. Simply not our normal time. For most of us, we have never seen such turmoil. I will emphatically state this: better days lie ahead. I honor you, each of you, for your dedication and determination to get us through this most difficult time. Today's webinar is entitled Reset and Recharge, How to Manage Stress in Uncertain Times. It is a design to take care of our own. We are very fortunate to have with us the subject matter expert in Jeff Dill, the founder and CEO of the Firefighter Behavioral Health Alliance. Jeff created Firefighter Behavioral Health Alliance, or the FBHA, to directly educate firefighters and emergency medical services personnel and their families about the behavioral health issues such as depression, post-traumatic stress disorder, anxiety, and addictions, as well as firefighter suicides. In 2001, Jeff founded the FBHA, and it's a 501c3. Jeff travels the United States and Canada holding workshops to educate fire and EMS about behavioral health awareness and suicide prevention. FBHA is the only known organization that tracks and validates the data of all firefighter and EMT suicides across the United States. In addition, FBHA holds classes for counseling, for counselors, chaplains, family members, and preparing for retirement. Jeff Dill holds a master's degree in counseling from the Argosy University in Illinois. He's a licensed professional counselor and retired captain of the Palatine Rural Fire Protection District in Inverness, Illinois. Jeff, the NVFC, and all our members appreciate you taking this time. And ladies and gentlemen, I give you Jeff Dill.
Thanks, Kevin. I appreciate that. I think we wasted almost our hour right there with the introduction. And I'm looking at that picture, and I think I've got a little growth growing here since I've been home in isolation like everyone else across the United States. Welcome, everyone. It's an honor to be here to talk to you, my brothers and sisters, both in the fire, EMS, dispatch, whoever's on there. If we have some counselors, chaplains, this is an issue that is very near and dear to me, firefighter and EMS first responder behavioral health issues. So today we'll be going over a few things that we've learned over these past 10 years. Like Kevin said, traveled well over 100,000 air miles every year. Might not reach that this year due to the virus, but it is amazing what is out there and what our brothers and sisters are struggling with. So as today we go through this, these objectives and agendas. Before we start, though, I do want to read a statement that was sent to me yesterday. The willingness of our nation's firefighters to face inherent dangers and risk to protect the lives of the citizens and the communities they serve remains unchanged. So what has changed? The dangers, hazards, and risks continue to increase in complexity and severity. There could be no better example of this than the current challenge we face in the coronavirus pandemic. Not only do these crises require us to alter or modify the manner in which we respond to them, but the stresses they create are different in how they impact our firefighters, EMT, and paramedics, both physically and emotionally. I am very concerned about the number of emergency responders that are testing positive for this COVID-19. I'm sure it's been a very difficult time for them and their families as they have been quarantined. As we see to their physical health, I hope we will place as much importance on supporting them mentally as well as emotionally. Regardless of the crisis, people matter most. And just as we have to think differently about our responses to situations, we may have to take different approaches in how to support those of our profession who have been and will be impacted by this disease. Please know you have the full support and the best wishes of the United States Fire Administration. Sincerely, Chief Keith Bryant, United States Fire Administrator. So I appreciate that message, Chief. These stressors that we'll be going through, it is real. So FBHA, as the Chief said, we track firefighter and EMS suicides, been doing that for 10 years. But that's not today. So we're going to look at other objectives, mainly talk about stress and anxiety. I've done a lot of surveys with our brothers and sisters across the United States and Canada. We'll be looking at those issues as we go along. We'll also talk about the coronavirus. Over the last few days, I've been talking to numerous fire departments, the chiefs, firefighters that are in quarantine. We'll talk about what they have to say through this next about 50 minutes or so. The chiefs that are talking about it, just some great insight, as well as the firefighters and their concerns. We'll also look at the power of positivity. We know that, I had 26 years on the job, that we tend to look at things a little bit negative. So we will address that issue as well. And then we'll talk about resources, what's out there. And so we'll look at that screen and talk about those. And then we'll have a little question and answer. And I believe the chief will somehow handle all that. And if we don't get to all your questions and answers, we will have our resource, our email address, my information. So if you want to contact me directly as well, we're available. So stress and anxiety. Well, we did a survey here and we found that over a 5-day period, we put out stress and anxiety and 942 responses we received. So that means 71% of those 942 suffer stress and anxiety on a daily basis. And as we go through this list, we can see sleep deprivation was absolutely number one. And that's a whole workshop in itself, a whole eight hour workshop. The sleep deprivation that we struggle with, the shifts, and I don't care if you're volunteer, career, fire, EMS, these are issues that we need to deal with. And stress and anxiety tends to really hit with that sleep deprivation. Out of those 942 responses, we found that promotional issues, that brought a lot of stress to their family members. And as we go through this list, you can see what these members were struggling with outside of promotion. Then we looked at shift work. I started as a volunteer firefighter way back when, And it's difficult being a volunteer firefighter. Not only is it that we respond to calls that we know the people in our community, but when we respond to those calls at 2, 3 in the morning, and then we have to be at our full-time job 3 or 4 hours later, we found that that type of shift work. And what about those career fire departments that are working 24, 48, 48, 96s, or whatever it is? It is amazing how many different types of shifts. The shift work, how it plays a role both in our lives for sleep, as well as families and our children. So this brought a lot of stress and anxiety as well. We looked at emergency incidents. I mean, there's no doubt about it. What we see and do can play an effect. But there's a little known fact in regard to this, and that is so many people think PTSD is the main issue. When we look at our firefighter and EMS and now dispatchers, we're starting to track dispatch suicides. We look at our data, and let me quick explain how that happens. We get a confidential report off our webpage, and when people submit it, I have no idea who handles or who sent it. The emails are scrubbed. I then contact the fire or EMS chiefs, and to date, we have validated 1,476 of these tragic events, and I have personally spoken to about 1,410 fire and EMS chiefs to hear, what they were struggling with, the methods, the reasons behind it. And we do this for many reasons. One is to understand so that we can bring that educational piece to our brothers and sisters across the U.S. But the other main one is to remember our brothers and sisters and the families they left behind. And so when we look at the known reasons for fire and EMS taking their lives, unknown is number one. The chiefs or the family members that contact us, they just don't know. But the number one known is marital and family relationships by far. So we know that stress and anxiety of the job creates those issues for us at home. And number two known reason is depression. Depression is very difficult to handle in society as well within our world. Number three is medical and physical. And unfortunately, this has moved up rather quickly in the past few years due to cancer in the fire service. We are getting more and more reports of fire and firefighters taking their lives because they don't want to burden their families, both emotionally or financially. Number four is addictions. And number five is post-traumatic stress disorder, diagnosed PTSD. And then, of course, there's combinations. I mean, there's others, there's legals, there's financial issues, but combinations. Maybe someone saw a call and they turned to an addiction to alleviate that, which then in turn ruins the relationship. So emergency incidents, it plays a major role in stress and anxiety, how we take it home with us. And I'm sorry, I've heard it many times from my brothers and sisters that, I leave everything at the job. That's not necessarily true. We take things home, and emergency incidents plays a major role. Next on the list, when stress and anxiety that people were struggling with, there's just so many different types of issues. Caroline, if you could scroll down to the next. Family issues, financial issues that we talked about, union, association, those issues within the job create a lot of struggles, management issues. And then we start looking at, the retirement. Here's a big one, retirement. Ask yourself today, what is your organization or department doing to help prepare your members for retirement? We have validated about 262, I'm trying to do it off the top of my head, 262 fire and EMS that have taken their lives that have retired. And out of those 262, 37 took their lives within the first week of retirement. This is an issue that brings a lot of stress and anxiety to firefighters and EMS personnel. Most of us are retiring in our mid-50s. Volunteers who had volunteered for 30, 40 years, and now they won't be carrying that pager. They won't be responding to their community. So what we really have to understand is to look at, instead of just giving them a party and an axe on a board or something, that we have to start pre-planning what retirement looks for our personnel. And, we're not going to go into that. We have a whole workshop on that. If you want any information on that, please feel free to contact me a little bit later. And of course, stress and anxiety from injury or death of their brothers and sisters on the job. And the last one, of course, now why we're here is the coronavirus. what is going on out there? Why did it hit so quickly? Why are departments, some are struggling? And if you actually Googled and say, hey, fire department, firefighters, EMS that are quarantined, the list is incredible. When you look at 80-member departments that have 10 people in quarantine, some have 150 plus of their members are in quarantine. So all that stress and anxiety, not only for the members, but for the chief to provide services for their community, and stress and anxiety can appear very quickly. So we'll go to the next slide, and we'll look at dealing with stress. Out of those 942, what they told us was they tried to avoid caffeine, alcohol, and nicotine, stimulants that increase stress. And I'm not going to spend too much time on that. You pretty much are aware of that. Physical activity, especially now that so many of us are isolated to our homes. Even if you can go out and take a walk maybe around the neighborhood, just get some type of exercise. Sleep, dealing with sleep. A lot of people we saw, they removed their TV from their bedrooms. They set a time limit of an hour before they went to bed. They would remove TV, don't exercise. Some though would say, hey, we would take a bath or do some reading to try to alleviate dealing with the stress. And so helping their sleep. Relaxation techniques, yoga, train your brain. Find words that can bring calm and peace for us. And one that I try to always use is, I love my grandkids. I have 4 grandkids, and I reflect back on, and we miss them right now, so that brings me stress. But having that calmness, that peace, thinking about the times when they were born, and that joy, and when they call you up on the phone and say, Papa, all those type of things bring a lot of relaxation techniques. There's just so many. We'll talk a little bit more about them. Talk to someone regarding your stress. Now, everyone's heard the word resiliency, and this, and how it's different to different degrees. For me, resiliency in my world starts with talk. And when you're starting to struggle, especially with this coronavirus, and you're starting to isolate, please talk to someone. Do not hold it within. And unfortunately, there's this thing within the fire service and EMS world, first responders, what I call cultural brainwashing. And it's not a negative term. It's one of, we put this uniform on, this is how we are expected to act. Strong, brave, courageous, give help, don't ask for help, we handle things on our own. And unfortunately, who expects that? Well, our brothers and sisters that we work with, the communities that we serve, as well as the traditions of the EMS and fire service. And when you're struggling with both personal or professional issues within your lifetime, that's pretty difficult to do those things on your own. And we'll be talking about addictions coming up in a few seconds. This is not something that I feel is a joke. A lot of people think, oh, I'm not writing a diary. They have a little book, has a little lock on it. It's not that at all. Keeping a diary, I use this with my clients that were first responders in Chicagoland when I worked up there. I would have them at the end of the day write down what emotions you went through and what triggered those emotions and how was it resolved. Did it resolve in maybe you had an argument with your loved one? What was the result of that emotion? Because when we talk to each other, when people talk to each other, we can kind of BS people on what we want them to believe. But at the end of the day, when you're sitting at home and you are writing down your emotions, you cannot hide what comes from your heart. It is amazing what words would come out. I had my clients come back a week later and tell me, hey, what emotions were you going through when you kept that diary? In tears, they said, I never imagined I was feeling these things, saying these things. So please, just, we always talk about doing this internal size up, and we'll talk about it a little bit later as well. But internal size up to me is take a look and ask yourself on a daily basis, why am I thinking this way? Why am I feeling this way? Why has this stress gotten to me? What was the reason? How can I resolve it? If you constantly ask yourself these type of questions, it is amazing how you can understand and how it makes it easier for your family as well. Take control. Take control of the event. When you're dealing with some stressful situation, we're very good when we respond to calls. We take control of the full arrest, the vehicle accident, the fires. So understand that we need to take control of those fires within our own lives and understand, doing that internal size up. The other one is manage your time. I know we're home for a couple weeks, and understanding managing your time, that relieves a lot of stress when you're able to not procrastinate and manage your time on a daily basis. And one of the biggest things, the last one, is we as first responders have to learn how to say no. And that's difficult for us because we always want to help out. We always want to be there for our brothers and sisters. We always want to be there for our families. And at times we have to learn to say no. So these little things that we deal with here will help us deal with our stress. Some of the negative stress coping mechanisms that the 940 or the 71% of the 942 said that they went through here. Of course, Carolyn, you can go on the next one there. They turned to drugs. They turned to their addiction. And we look at the list, and you can run the list out there, Caroline. Pain medicines, alcohol, and smoking. These were some of the things that they were using to cope, and especially the communications, the lack of. They stopped talking to their friends. They stopped talking to their loved ones. And so watch out for these issues, especially in this time where we're home alone a lot or isolated from the world and we're just by our loved ones or our families. Just like I said, watch out what we're doing. So solutions, number one is counseling. And counseling doesn't mean you have to go to a professional. It could be, hey, I'm talking to my chaplain. I'm talking to some friends. I'm talking to my peer support teams, my CISM teams. And that's what counseling really is the ability to talk. And as a counselor, we're not there to solve your problems. We'll help guide you and walk that path with you, just like a peer support team member does. So start learning how to talk, learning how to open up. Consider joining a support group. We're starting actually to see this a lot in the fire service. We have fire departments creating either online closed support groups, or they're holding support groups in churches or wherever they can find an office so that people can come in once a week just to talk. And so consider building these in these difficult times. Other solutions, we talked about relaxation, talking to family members. They can help. They absolutely can. Therapists, they have these self-help materials. Stick to them. Give them a try. Don't just say, oh, this isn't for me. Try it. You never know what might be for you. And there's just numerous different opportunities out there to help you deal with your stress. So, and of course, regular exercise. I like to walk, usually listen to my country music. Here's a big one when we talk about stress and anxiety, how anger can appear. And I can tell you, I could speak from authority on anger. There's no doubt about it. This is an issue that I still have to deal with, even though I'm retired 5 years from the fire service. Anger, it's amazing where it comes from. And I can tell you two things about my anger. One is that I didn't have it before I got into the fire service. And the other one is, and I'm not blaming my mom's side, but we have a strong Italian influence on my mother's side. And so I don't blame them for that aspect. My grandpa's, great-grandpa's last name was Galeazzi, so a strong Italian influence on that. But anger is something that we need to really watch out for in the fire service. When we did a study and we started really traveling around and talking about anger, where we really found it to be commonplace was promotional time within the fire service. Well, now we're looking at anger because in this last couple of days, like I said, I talked to firefighters that are being quarantined. Many of them found a quick anger in regard to the public that wasn't being honest with them when they went and responded on calls. And therefore, then they found out later that they were possibly infected with the quarantine, and now the first responders. So that anger, it plays a major role. And we have to understand how to manage that. Because once we understand it, doing that internal size up, it makes it a lot easier to be around our loved ones. And Carolyn, if you go all the way down to this term that I want to use at the bottom, it's called cognitive, one more, there we go, cognitive disconnect. And what is cognitive disconnect? In my book, it's this. We base decisions on our emotions. So whether it's guilt, depression, jealousy, or anger. And let me give you an example, okay? And this is just my point of view, but from the things I've seen over these 10 years, this is my scenario that I feel happens out there. When we're out there working and we put this uniform on and we go to the stores and people are saying, oh, thank you for what you do. You're our heroes. You're heroic. You're courageous. Our children want to be like you. And you have parades and you're going along in your tower ladders and your engines or your ambulances and you got candy and you have water pistols and everyone loves you. Then you go home to the one person who doesn't put you on that pedestal. And then maybe in the heat of an argument, as you're going back and forth, this little thing called cognitive disconnect comes into play, where the thought process is, why can't you treat me like John Q. Public? And they base decisions on that anger. And what happens, what we're seeing, are murder-suicides in our data. Out of the 1,476, we've had 60 of our brothers and sisters that have killed their loved ones and then themselves. And so we really need to understand anger, how it plays a role, how we do take it home, whether we want to admit it or not, we take it home. So please do that internal size up, watch out how anger can play a role, and it can be built up with stress and anxiety when we're at home. And we have nothing to do but think about these different types of issues and how it affects us. Depression, well, this is a tough one. Depression, 41% of those 942 that did the survey felt that they are dealing with depression-like symptoms on a daily basis. And understand, as a counselor, one of the first things we were taught when it comes to depression is you have to have a medical diagnosis. You just don't know what the chemical imbalance is that's going on within your body. So as a counselor, we would always send them out and make sure the blood work and everything was working out. But these issues that you see on this screen are from those 41%. They had mood issues, anxiety, general discontent, guilt, hopelessness, sleep issues. And we've already talked about that. Whole body, hunger, fatigue, loss of appetite. I know in my house right now, if I'm not working, I'm looking for food. I have no idea why. I don't know if it's because I'm bored. Hey, I'm looking, oh, those little Easter egg, peanut butter Easter eggs, they look pretty good. Maybe I'll have one. And it's amazing how we start looking into these things. Well, if you start continuing this, all these different types of things that you see on this board here, please understand that depression, it can play a role in our lives. Understand what's ever out in America, we are now seeing in the fire and EMS world. Kevin, did you have a question or something? Someone asked a question?
No, Jeff, I was just responding that we are getting questions, but we're going to take them later.
Oh, okay, great. All right, that's fine. Behavioral health issues, excessive crying. I found this pretty ironic because out of the 41%, I had 5 people who responded back saying they would be watching a comedy show, a movie or something, and all of a sudden they were crying and they couldn't understand why. So once again, read your emotions, do that internal size up. Why am I acting this way? And then cognitive, lack of concentration, and especially thoughts of suicide. Depression is something that you cannot deal with on your own. You need to ask for help. You know, we are at our strongest when we put pride to the side. I like using that phrase, put pride to the side. And understand, I've always been perplexed by this wall that we've had in the first responder world. On this side of the wall, strong, brave, courageous, give help, don't ask for help, handle all things on our own. On this side of the wall are the counselors and chaplains. And if you went over there, you were looked at as, oh man, they're pretty weak. I don't know if they can do the job. And like I said, this has always perplexed me because our whole job and even as volunteers, has been predicated on responding to those who called for help and asked for help. Where did it go wrong that we could not ask for help in our world? So please, but the good news is that wall is coming down. Brick by brick, it's coming down. Why? Because we're having brothers and sisters stand up and say, if I'm struggling, guess what? You might as well. We're having counselors and chaplains who are going back and being educated on our world, our culture. And it is different. We have a certain language that we live by. We have a certain type of air about us, saying that, not that we're heroic, but we will sacrifice our lives for you, people that we don't even know. And so it's good to see that wall finally starting to come down. Next, addictions. Oh, when we look at this list, these top 5 here, alcohol was the number one. 17% of the 942 said that they are struggling with addictions on a daily basis. And alcohol is number one. And why not? Alcohol is our easiest access. When we're not sleeping, when we're stress and anxiety is overwhelming, maybe relationship issues, health, family issues, the job, we were always told under that cultural brainwashing, handle things on your own. And guess what? Going down to the liquor store, picking up a 6-pack or whatever your choice is, hey, I didn't sleep so bad. The stress wasn't so bad. The anxiety, the nightmares weren't so bad. Now I'm on shift, or I signed up as a volunteer for a day or two. I can't touch the stuff. But guess what? I'm off for 2 days. I'm off for 3 days. I'm off for the weekend as a volunteer. I'll just go down to the liquor store. Hey, I didn't sleep so bad. Nightmares weren't so bad. Stress and anxiety didn't seem so bad. And boom, you're hooked. It doesn't make us bad people. It's just that in our world, we have always been told, handle things on your own. Don't bother anyone else. Any of you out there remember the days way back when they said, hey, you leave all your problems at the door when you walk into this station. And this is how we handle alcohol. Gambling, it kind of surprised me, but not really, was the number 2 addiction among the 17%. And I started talking to people and understand it. What happens every time those tones go off? Boom, heart rate goes up, blood pressure goes up. That adrenaline feeds our ability to respond, and your body gets used to it. So when you're doing it week after week, month after month, year after year, your body looks for it. It looks for that adrenaline rush, and gambling presents that. And so understanding that fear of these addictions starting to pop into our lives, especially since we're at home, is something that we need to understand and control. And so watch out for that gambling. It feeds that adrenaline. And then you see smoking, eating, and pornography were in the top 5 in regard to addictions. And there's many more. So how do you get help? Well, counseling, inpatient treatment, outpatient treatments. Let me talk a little bit about outpatient treatments, because this is important. There are about 4 or 5 inpatient that I refer to, and I won't get into that right now. And I only refer to them because I've been there. We do not get kickbacks. We do not get any type of funding or support financial. It's only because I've been to those places that I recommend those. But even out of those 5, when I have referred firefighters or EMS personnel or even family members, when I have referred them and they came back 30, 40 days later, they would call me, give me an update and say, Jeff, I appreciate it. I'm doing a lot better. But what they weren't expecting were the bills that they were getting when they left. Anywhere between $4,000 to $16,000. And so I tell departments when I speak there is, before you refer someone to an inpatient place, figure out what that final bill will be before they get home, and understand, or even before they get there, find out, what's my final bill going to be? Because now you had that stress and anxiety of all that, trying to recover, trying to maintain, and now you have this big bill as well. It adds a lot more stress and anxiety to our members who are trying to recover. So let's talk a little bit about some of the chiefs that I have spoken to. Chief Holmes from Covington, Georgia, and Chief Breyer from Palm Beach Gardens are 2 that said, please, share our stories, talk about the things that we're going. I spoke to so many other different or other chiefs that just said, hey, we just like to, at this time, keep our name out of it. And I have no problem with that whatsoever, because it's the information that we want. But when we look at Covington, Georgia, and this is their story, how they got involved in, 4 members were given inaccurate information on a call. They went for a lift assist, and then they went back to quarters, and they were told, hey, the patient, no symptoms, no problems. Well, 2 days later, they come to find out that the patient started developing symptoms and was also then infected. So they quarantined them at the station. And he says, in hindsight, and he admits it, he made a split decision at that time that the quarantine them in the station and not to send them home because of the fears of taking it home to your family. He said, maybe we should have done something where other departments have. They've rented out hotel rooms, they've rented out houses to put their people in. And now, so right now, that station belongs to 4 firefighters, and they are quarantined for the 14 days. It is amazing what their daily assignment is. And it's got to be difficult, to be away from their family. They're part of the team, though. They still clean the rigs. They do things around there, but they had to clean that station. And they also had to move the other members that were on the other shifts to other stations. So, they were going by early on the CDC guidelines, but then they had some different type of conflicting reports on the quarantine. So, these issues are new. We're muddling through them as we go along, and we just don't know what is right and wrong early on. And so either way, they're safe. And that's the bottom line. They're safe. And what the chief, what he really wanted to highlight, Chief Holmes as well as Chief Breyer from Palm Beach, is that communications is essential. It's absolutely essential to talk to your people, especially those in quarantine. These departments and several others that I've spoken to, from smaller departments to big departments, are holding daily briefings. They'll get involved on some type of format, and they will, in conference call, and they will talk to each other. Let them know, because what we're finding out is from the chiefs as well as the firefighters that there's fear. There's fear. They don't know. It's that unknown. And remember, we're all human beings. And it's that unknown that scares us. And that gets into that stress and anxiety that we started seeing. So, either way, whether the decisions at that moment were right or wrong, they're safe now. And Chief Holmes is a big advocate in protecting his people as well as the community. The community has responded tremendously to these 4 firefighters. So he wanted to give a lot of credit to his community as well. Now, Keith Breyer, he has put together some guidelines and policies, and I have those. He forwarded them to me. If you would like to see what those are, he said, by all means, send them out to you. So later on, when I give you my website or my email, if you want to send me an email, or maybe I believe even Caroline might have put it on the NVFC's, their website, just take a look at them and use them as a guide for your own organization. Because that's what it's all about, is let's share the information that we're gaining as we're going through these situations. Now, one of the major cities, their human relations department that I talked to, said, we're abiding by the CDC, information to members, but we really are emphasizing clean gear, self-cleaning ourselves, especially prior to going home. There's also one chief that I spoke to who has been infected. And so he himself is quarantined. And he said that, it is terrifying. It is terrifying to, be infected and be in quarantine. But for his department, they've done a very proactive stance on those members that are coming onto duty. They are met outside on the, out on the apron. Their vitals are taken, their temperature is taken, And if everything's normal, then they go in to start their shift. 12 hours into their shift, their vitals are taken, their temperature is taken as well to ensure that nothing changes during that 12 hours. And then when they go home, guess what? Their vitals are taken, their temperature is taken before they send them home. Very proactive. And he said, we've had no complaints from our members. And this is a rather large department. We've had no complaints because they know they need to abide by this, not only to help protect their brothers and sisters they work with, but also their family members. So, we're having a lot of people share these issues, especially the fire chiefs. And I thank Chief Holmes and Chief Breyer and the other chiefs as well that I spoke to regarding different issues that they're dealing with. So let's look at how it's affecting firefighters in quarantine. Many had the initial reactions of anger due to the public not being truthful. Some went home after shifts only to be called to be advised patients tested positive. Concerns and fear for their family, children, and pregnant spouses. This was a big one. That, oh man, that stress and anxiety. Am I a carrier? Will the signs show 5, 7, 10 days later? How do we handle this stress and anxiety? When you're in 2 weeks of isolation, it can be very difficult. Isolation is something that we can do to ourselves when we're struggling. And I bring this up because our top 5 warning signs, FBHA top 5 warning signs, when we looked and interviewed over 500 of our brothers and sisters who were struggling with PTSD, depression, and suicidal ideations, the top 5 that came back to us were recklessness and impulsiveness, anger, isolation. So they found that they started isolating because of all the issues that they're dealing with. Loss of confidence and skills and abilities is in that top 5. And of course, the last one was sleep deprivation. So now that we have taken isolation to a different look at it, instead we're now isolating ourselves to take care of ourselves in quarantine. Could that not open the door for some of those brothers and sisters that are struggling with issues like depression, maybe bipolar, maybe addictions? Maybe they're having relationship issues, and now they can't be with their loved ones to try to solve those issues. And so this isolation in this aspect can be just as important of an issue to understand and take care of within ourselves. So like I said, please, and I reiterate it time and time again, look within yourself. Ask yourself, why am I feeling this way? Why am I acting this way? They recommended many things, especially if you're isolated in groups or if you're in your family. But they recommended don't take any call for granted. And we're starting to see that. We're starting to see departments. I spoke with one chief. Every call, the engine crew will go in or the engine crew will respond. One person is completely geared up in their SCBA with mask. They will go in and do an assessment of what that situation is. Many departments are now sending out squads to go out and to investigate to see what the patient, what they were struggling with so that they didn't infect whole companies. So this is a big issue. So developing tactics and guidelines they recommend, and also work with your dispatchers to train, to screen people as they call in. One of those guidelines that Chief Breyer from Palm Beach is, it does have something in regard to how to screen for your dispatchers. But they also said, please, if you're quarantined, either in your station or with your family, to do things as a group. Keeping that group dynamics together is important. And just because you're isolated, and I know it can be tough being with your family for 2 weeks, still try to do things in groups. And that absolutely helps with any types of depression or whatever issues that you might be dealing with, knowing that you're all part working this as one. One firefighter who I spoke to did want to credit his chief in regard to that they're, and this is the Covington, Georgia, that they wanted credit Chief Holmes in regard to not overwhelming them with tasks, meaning, now you're at the station, you're not running calls. They are doing what they're supposed to do. And they wanted to give credit to Chief Holmes for that. So there it is. I did my due diligence on that. When we also look at firefighters in quarantine, I started thinking about this issue. And many of these things come into play, like guilt. Guilt on, what am I doing to my family? What am I doing to my brothers and sisters? And the frustration of that as well. They don't want to take things home to their family, and yet they're frustrated that their brothers and sisters are responding on these calls as well. So some of these things can really come into play big time. How about post-quarantine? What are we doing to help out our brothers and sisters emotionally for the post-quarantine? Many who have come off quarantine that I spoke to said that there was a lot of sadness. There was a lot of anger. There was a lot of questionable from family members and neighbors thinking, oh, I don't want to be near them. They might still be able to infect me, or will they catch it again? And these type of frustrations need to be addressed by departments in regard to those fire and first responder, EMS, dispatchers, nurses, doctors, whoever it is. They need to be addressed, that post-quarantine. And we also, when we think about it, being isolated, how about OCD? Does OCD now really start coming into play? Because many of those in quarantine, they're doing their vitals twice a day. And they're worried, will I catch it? Will I be infected? Now, does that now become part of us once the 14 days? Will we start being a little more OCD on the cleanliness aspect? Will that bring stress and anxiety to test? Yes, thanks, Kevin. Yeah, the obsessive compulsive disorder. Sorry. Thank you for spelling that out for me. Will they become obsessed with taking their vitals on a daily basis, 2-3 times, to make sure they're not taking home to their families? So we need to watch out for this, both family members as well as within ourselves, our brothers and sisters. Because like I said, this is the time that we've never handled these things before, and we need to just start thinking a little bit about that post-quarantine as well. But the biggest issue that everyone can relate to was communications. If you want to go to the next slide, communications is absolutely imperative, and positive thinking is next to it. I love this quote by James Baldwin. I've always believed that you can think positive just as well as you can think negative. In our world, in the first responder world, negativity is abound. And I always ask our firefighters in our workshops, do you think that you've become a little bit negative? And most of them, in fact, all of them are shaking their heads. And those think, well, maybe I'm not. And I always tell them, let me ask your family. I think if I asked my wife, she would tell me the correct answer, being married 40 years. But turn our negative into positive. This is our time right now. We have 2 weeks if you're in isolation, quarantine. This is the time when you have just a few minutes of downtime in the station before that next run. Start thinking positive. We will get through this. We will handle it. It will be a struggle for many of us. And unfortunately, in our communities, we will lose people because of this virus. But you can control your own thought process and turning that negative into a positive. What can I do each day to start that day and make it positive? There's a great story of a general who talks about the best thing that you can do to start your day on a positive note is to make your bed. It shows you that you have accomplished something. And we as human beings, we like that. We like to accomplish things. So even starting your day by making your bed is a positive way of putting a spin on that day. Please practice that. Once again, do that internal size up. Why am I acting this way? Why am I feeling this way? And the best thing you can do is listen to others. They see us a lot better than we will ever see ourselves. I will never forget the day I came home. I was about 3 years in my career, and I can recall my wife saying to me, Jeff, you seem to have changed. And I said, well, that's not true. I'm still that bubbly 19-year-old you married in 1980. Heck no, that person's long gone, long gone. and understanding that if we listen to others, it's imperative. You know, I like tend to think, hey, you know, I'm all this happy-go-lucky guy, and my wife reminds me, and so I have to listen to her. I listen to people. Hey, Jeff, you look tired. Jeff, you seem to be doing a lot more. Listen to people, listen to yourself. Inspire hope to each other, hope to our families, our friends, our community. Maybe you want to make a little video saying, hey, you know what, this is your fire, this is your EMS organization. We're out there to help you. Please do not despair. We will be there for you. We will be by your side to get you through these things. Understand that positive thinking is imperative. Next slide. These are the resources, and you can go through them. And yes, that is Captain Jeremy Mathis, Covington, Georgia. He said, please give out my email and my cell phone. He is one of those quarantined. He wants to help our brothers and sisters. If you have any questions, comments about what that looks like, what he might be struggling, dealing with, feel free to give him a call. I love that. I love that about our brothers and sisters that are willing to stand up and say, I'm going through this, let me help you. So those are the resources that you can find. The CDC, Fire Strong out of Arizona have some great resources. The NVFC has asked FBHA to assist them in creating a national registry of counselors for first responders. And so we are currently in that process of gathering that information. And if there's any counselors on here, or if there's any firefighters, EMS that you personally see a counselor that works with first responders, send me an email, send me their name so I can send them a form to see if they want to be on that national registry. There's no cost to it. It's there so that when our brothers and sisters are struggling in California, Louisiana, New Hampshire, they can go on a national registry and see which counselors are in their area. So I guess, Kevin, this is your time.
Okay, Jeff, we've got a number of questions. We're going to just try to fire through them. One is from Stan. He's talking about the fear factor and how we can't see this infection, this virus, and how much it's affecting the brothers and sisters in the boots on the ground. But basically, I think that piece that you talked about earlier, where our dispatchers are asking the questions, EMS is sending in an individual to check on things and make sure that we're assessing before we put others at risk. When they get to the hospital's doing the same thing, but there are folks that are lying. They're not disclosing. And how do you react to stand on that, Jeff?
Well, being on the job, and you as well, our first response is to be there for the community. And when we get back from those calls is when the fear factor really kicks in. But understand, to me, knowledge and education is important, to constantly learn on what the effects are. And it goes back to that unknown, Stan and Kevin, and to those out there. It goes back to that unknown of what are we dealing with? How will it affect me? So if we can educate, if we can do this together as a department, if we can do this together with your hospital, your community, and that goes back to that communications. Let your community know what's going on. Ask them, hey, before you give us a call, tell the dispatcher that you have these symptoms. And that will start alleviating the fears that we have when responding to calls.
Great. The next question, actually, Carolyn, can you just put up the next slide with Jeff's contact information while we're going through the questions? Great. Keith is asking, with companies being shut down, volunteer companies, limited response, only so many people, duty shifts or whatever, training is shut down many places because of the virus. And is there a one-pager or a website, one place? I know we just put our resources up, but he's looking to simplify how we can get more help.
That's a difficult call because so many departments, especially the smaller volunteers, are looking for help. How do we handle this? If we're a small department of 45 volunteers and 20% of us are isolation infected. So what we've seen, and I've seen it out there, is that they're asking for any retirees in their communities who might want to come back and maybe do some different type of task to help them, maybe train them in being responding to certain calls. This, like I said, it overwhelmed us rather quickly. We knew it was coming, but it's like anything else. Once it's upon us, now we're struggling to stay afloat. And for those small volunteer departments, we're starting to see where they're starting to consolidate with other surrounding departments to help become one bigger department to work together on these calls. There might be some delays, time delays in responding because of that. And those issues, though, they need to be looked at, they need to be addressed. So that's the best I can tell you right now is look into your community, see if you have any retirees, and look into your surrounding communities to see if you can really build that mutual aid package.
Next question from Stephen. Any suggestions on stress eating?
Stress eating. That's, like I said, I'm trying to deal with that myself. For me, when I feel that stress coming on, I drink water. I try to feel something in my body that will take away that eating. Stress eating is very difficult because, it fills a need. And that's what it is. It's filling a need. So we need to look within ourselves and say, how can I, in a positive way, fill a need? When I feel that stress coming on, for me, I love cereal. I'm a big cereal eater. What can I do to throw that thought process? And that's what it is. It's a thought process that I need to fill something. What can I do? Maybe I can call a family member. I can call a brother or sister that's in isolation and just talk to them, try to divert that thought. Maybe I can go out for a walk, something that brings some positive to it instead of that stress of filling that need.
Next question from Eugenia. How can I support fellow firefighters in law enforcement?
That's a great one. And I think a lot of it can be, what can you do for their families? What can we do? Can I make some meals? Can I, is there something, if a firefighter is isolated at a station, is there something I can do to help out the family members? Cut a lawn, whatever it is, look at their families, because that is one of their biggest fears is their families. And if they're isolated, they can't get out and do things. Maybe you could, if a family has to go to a doctor or something, I don't know. You have to ask the family members, but that's one of the best ways that you can do to help our law enforcement, our police, our EMS dispatchers, is to see what are the needs of the family.
Teresita is asking a question, and I think it kind of relates to what we're doing here with this Zoom chat and this educational forum. She's asking about video chats and being able to connect with people even though they may be isolated.
And I think that's key because as I stated earlier, that numerous firefighters, they like that. They like to stay in contact several times, not only with their families, but they can talk to them through a video chat on conference calls. Hey, how's it going? How are you doing today? And talk about the emotional aspects about it. Don't hide those things away. How are you feeling by being isolated now 10 days? You have 4 more days. And so talk about the issues. So I absolutely agree that there should be some type of video or some type of conference call, keeping people in touch, letting them know that you're thinking about them.
Next question, and unfortunately there's a number of other questions that I'm not going to get to during this webinar. So as Jeff stated, if you have questions, the contact information for the NVFC and for Jeff is on your screen. I apologize for not getting to the questions, but we'll ask one more. And Jeff certainly and NVFC will follow up on anything that you have. And I've seen a lot of comments on board here about maybe making something else happen in the future. And I know we'll be working towards what we can because the things that Jeff has shared with us have been vital. So the last question we'll put out is, Jeff, what is the best way to protect our firefighters from exposure?
Well, first off is that what are our plans now? What are our policies and guidelines? How are we responding in full protective gear? That is just what we're starting to see more and more departments do. And then that one person who will go into the scene, unless it's, some police issue, you don't want to just send someone in there, but on a typical call, they are going in full protective gear, and they will then decide what will be needed for the remaining crew to come in? Do they have to be in full protective gear, or do they need just masks along with face shield protection to assist this member? So that, like I said, those are some ideas that we're starting to see departments put into action, and right away they're put into action. Kevin, I just did want to say, someone said something about my email address. It's in blue, it's difficult to see. It's jdill@ffbha.org. So jdill@ffbha.org. And I'll answer your questions. I'll be there. It might take me a while, but I will get them done. I see a lot of questions on there.
All right, and with that, Jeff Dill, I want to thank you so much for your expertise and your sharing information. Thank you.
Thank you. It's been an honor.
Thank you both. Thank you, Jeff. Thank you, Chief Quinn, for helping out with our webinar this afternoon. So we can also have a post conversation on volunteer voices. If you're interested and you are an NVFC member, I will start a conversation there. We'd love to get your thoughts, any additional questions. And as Jeff said, you can contact him. Sorry, we are just a minute or two over 3 o'clock, but we are going to wrap up now. I want to thank the audience for listening in. This was a great presentation by Jeff, and you guys really asked some great questions. And I also want to mention that when you close our webinar, a survey will open. So if you wouldn't mind taking a few moments to take our survey, let us know how we're doing. We would appreciate that. Thank you again for everyone, and I think we'll wrap up.
Thank you.
Take care, everyone.
Be safe out there.
All right.